Good evening, ladies and gentlemen. My name is Devin Rohr, and I'm going to talk to you today about the importance of communication in physical therapy and how the bonding between a patient and a physical therapist or a doctor and a patient is critical to self-healing, physical healing, and mental healing. All of us want to be heard, but have you ever been to the doctor and you've just gone in there and they just haven't listened to anything you said? They just come in, ask your weight, ask your height, have you step on the scale, take your shoes off. How are you feeling today? They take your vitals and they walk out of the room after the nurse does that and they say, I'm going to send the doctor in. It's a terrible feeling. We've all experienced this probably, right? At least I know that I have. And besides manner, bedside manner is just one of the many types of communication that is very poor and that is very mistreated and a very, very bad thing. Physical therapists and assistants give higher quality care and build better patient relationships when they're equipped with communication skills. What do I mean by this? The three important domains of communication are improved care treatment, pain relief, and cultural awareness, because everyone comes from a different background. The three domains of applied communication that showcase the skills are these three. But first, how positive communication between physical therapists and patients leads to improved quality of care. I want to dive into that a little bit deeper because I feel like it's a topic that's not stressed enough and something that really should be truly covered. So, with this, it may seem trivial at first, but pain management is a nonverbal and verbal communication which leads to pain relief in patients because it's altering the mindset. It may seem that it's not very effective, but until you go through it, then you can really start to see that it is very effective. I want to explain how cultural barriers also pose issues from treatment and how understanding those barriers can lead to improved care. The enhancement and awareness of communication skills in physical therapy results to enrich patient and physical therapist relationships, treatment quality, and awareness of cultural barriers. Now that we've discussed these three things, I would like to kind of go into the rest of it. The first one I really want to get into detail with is improved care. The first point I'd like to talk about in the role of communication plays is patient physical therapist. What do I mean by that? I mean, the interpersonal relationship developed by the patient and therapist is directly tied with the treatment success. The better the relationship you have with your patient, or the better the patient has with the relationship with their doctor or physical therapist, the whole better the treatment's going to be, and they're going to feel like they're at home being taken care of by one of their loved ones. This was shown to me from research by two people, Rita B. Ardidio and Daniela Rebelno. That is when they established between the patient and physical therapist that treatment plans and overall quality of life and improved in the patient. These studies were taken over the years through multiple patients from different trauma effects, different issues, diseases, etc. And it showed that studies have shown that from brain scans that in just conversations with people that 9 times out of 10 the patient felt more at home, more comfortable, and the treatments went a lot better. This makes sense because when the patient has a good relationship with their physical therapist and trusts them, they're more likely to adhere in treatment and they're going to want to come back and stick through to the plan. The biggest thing is commitment and consistency. You can't achieve anything without consistency, especially in a physical therapy environment. In another study conducted by Ernie Gamble, another physical therapist and someone that had ventured out in this world, he had a physical therapist that were more positive. He had physical therapists that were more positive and a more driving attitude. He had learned that with those qualities, just those two alone, plus with the schooling and knowing everything, that we could become more adherent and better around the world. So that's kind of the improved care topic I want to talk about. Patient-therapist relationships. Trust leads to improved follow-through and care. Empathy leads to a higher bonding, knowing you're going to be there, show them some love. And a patient wants to be understood at the end of the day. It's not just caring and empathy that physical therapists need to show their patients, but need to show experience and communication. This will help lead to a positive relationship with the patient because they will feel more confident in the physical therapist's ability to help them. Researchers Jensen and colleagues have found that inpatient-centered approach model was an ineffective of high therapist to patient expertise. This means putting the patient at your level and having a various focused interaction made it all around better, and the success rate of each time was very higher and higher and higher. Sitting the patient down and having a true meaningful conversation better allows the physical therapist to not only go to the patient and understand how the injury is, but also affect their life in a positive way and also better understand the diagnosis of what's really actually truly going on. By using these tools in reflection and active listening, you're better able to communicate with the patient while putting them in the center of focus. The center of attention, this is a big one. Communication is essential in a physical therapist repertory. That's not just for bonding with the patient, but for reducing the pain. Communication, both verbal and nonverbal, whom gives while administering treatment, has been shown to reduce pain compared to treatment without interactions with the physical therapist. Treatment after, though, in a study conducted by the treatment and in the physical therapy, PhD George Fanounis, had 117 patients with chronic lower back pain, 117, mind you, and they split them into 4 groups. The first received electrical therapy, everybody listening, thank you, after limited interaction with the physical therapist. The second received the same electrical therapy and was given enhanced interactions while doing the physical therapist during the treatments. The third group received limited interactions while hooked up to the electrotherapy machine, but was unaware that the device was not connected, so it was a mind trick. And group 4 received enhanced interaction while also being hooked up to the electrotherapy machine, unaware of disconnected too. George Fanounis showed that the patient showed the greatest pain structures and reduction was given enhanced interactions and administrating this real electrotherapy. The end result was your intuition. It makes you sense that this gave them great pain reduction. So basically, he was tricking their mind and showing them that some were getting electrotherapy shock and some weren't for lower back pain. And we were comparing a study of, is it more mental or was it more physical kind of issue? This is a big thing. And this goes back to the trust building exercise, the active listening, the meaningful interaction. It all ties back together the same thing over and over and over. Now we're back to the beginning. But lastly, I'd like to kind of touch on a few other things before we wrap this up, and I really appreciate your time with us. Lastly, with all of this, I'd like to talk about the vital role communication plays with the link between cultural awareness and effective treatment. Physical therapists have a cultural competence in order to provide care that is in line with the ideas of the patient, that also helps build trust and create respect with the patient. Cultural competence is important because it can prevent non-discriminatory factors and make them feel at home no matter age, race, gender, sex, marital status, anything. This understands the allowance of the physical therapist to give the top of the line care to all the patients that come to the door, no matter what background or what they are from, which in turn will also make the patient more comfortable, and it'll increase their trust, and faster it'll build a better relationship, getting them on a better road to recovery. The next time you are helping someone in a professional, remember bedside manner can make a difference. This is all I want to talk to you guys about. Thank you.